Welcome to People. I'm Micah Mater. Let's get started. Trauma, financial strain, unemployment, all challenges that we all face, but they are stressors that are often amplified through the lens of racism and sexism when it comes to black women. Now, Dr. Burnett Zeigler is a licensed clinical psychologist and associate professor at Northwestern University. She's also the author of Nobody Knows the Trouble I've Seen, The Emotional Lives of Black Women. Doctor, thank you so much for joining us.
Thank you so much for having me.
Always great to see you. This is your first book, and congratulations on that.
Thank you. Thank you.
First of all, it's described, and I think you describe it, as a roadmap to help black women to find a healthy balance between strength and vulnerability. How do you do that in this book?
Yeah, so we know that the strength of black women is often held up, as it should be. Our strength is what allows us to get through stress and day-to-day challenges and racism and all of the things that many black women face as they encounter the world. However, what's less often talked about is the vulnerability, those things that we don't often show people, those struggles that we experience, what sometimes is depression, what sometimes is trauma and relationship difficulties. And what I want black women to know, and people in general to know, is that there's strength in showing that vulnerability. There's strength in talking about some of those things that might be challenges that we're facing. And when we do that, we're able to create community and we're able to better take care of ourselves. And so this book is a way to both honor our strength as well as honor the vulnerability that we all possess as well.
By covering that up and holding it in, what does that do to us on the inside that we don't even realize?
Yeah, when we cover it up, it doesn't go away. It can really eat at us and have an impact both mentally as well as physically. Mentally, it can cause stress and depression and anxiety and sometimes even suicidal thoughts. Physically, we know that stress is related to cardiovascular disease, things like hypertension and heart disease. Stress is related to obesity. Stress is related to diabetes. And these are all chronic health conditions that are disproportionately prevalent among black women. And so by attending to ourselves and attending to our stress, we take better care of ourselves both mentally as well as physically.
So folks who are watching today who may suffer from that and may not even know it, how do we preempt that? And then I'm going to ask you how, once you're in it, how you get out of it.
Yeah, we preempt it by slowing down and just taking the time to really pay attention to what's showing up in our being. COVID, one of the positive outcomes I think of COVID was it forced us to slow down. And I hope that that's something that we continue to take with us as we reemerge in this kind of post-COVID life, slowing down and paying attention to what's in the mind, what's in the body, what our behaviors are telling us. And when we do that, we can really better take a self-assessment of how we're feeling and how stress might be showing up in our lives. And when we pay attention in that way, then we are empowered to do something about it, to be able to manage the stress that's showing up.
I think the first thing to say, and tell me if I'm wrong, is don't think of it as a sign of weakness, because that's the last thing you want to tell a black woman, that they're weak. So once you're in this, once you have this stress, once, regardless of the pandemic, how do you get out of it?
Yeah, you get out of it by when you pay attention and you recognize what's happening in your life, you're then empowered to be able to make positive behavioral changes. And so that can mean a lot of different things for different people. That could mean being more embedded in the support that's in your life, taking that time to engage with your friends and family. That could mean taking time to rest, something that so often we don't give ourselves the opportunity to do. It could be setting healthier boundaries with work and the people that are in your lives. And importantly, I must add that it could also mean seeking professional mental health care.
I was going to ask you that, because there's such a stigma in the black community when it comes to that. So how do we break down these barriers and let folks know it's okay to do that? And it's also expensive. So are there places that they can go that don't cost as much money?
Absolutely. I want people to know that you don't have to wait until you're in a crisis situation in order to seek professional mental health care. Professional mental health care can also be sought as a preventative measure. Some ways to determine how or who to see or where to go: you can always start with your primary care physician. They often are able to provide good recommendations for mental health providers. If your employer potentially offers an employee assistance program, and these services are often time limited and free, where you may be able to get about 4 sessions for free. And locally in Chicago, I want to lift up another sister that's providing mental health services, Sister Afia, who provides mental health services specifically for Black women at low cost and sometimes free services as well. And so these are just a couple of options for professional mental health treatment.
Should a Black woman see a Black female therapist?
You know, that's often the preference, and understandably so. You know, when people are thinking about kind of engaging with someone, it is a vulnerable place, and often you're talking about sensitive subjects, and so they want to be in a space where they feel understood, where they feel that they won't be judged, and someone who's inherently going to kind of get it. And so I honor that, and I think that I do understand why that's important. It's also important to keep in mind that there are just not enough Black female providers to meet the needs of all Black women who might be seeking mental health care. Data from the American Psychological Association lets us know that less than 5% of psychologists nationwide are Black men or women, and even fewer are Black women. So while that might be a preference, I certainly don't want it to prevent someone from getting any help, because there are many people that can help with depression, stress, and trauma, even if they are not Black women.
And quickly, how do you recognize you're in trouble?
You know, there are some telltale signs. You might notice some physical signs. You might be getting headaches or muscle tightness or tension or discomfort in the belly or difficulty sleeping at night. These are some of the physiological signs. Behaviorally, you might notice yourself being more irritable, being more short-tempered with your family or with your children. You might notice yourself having difficulty getting up and getting out of bed, or calling off from work more often, or forgetting things and being unable to carry out your typical day-to-day tasks. All of these signs, whether it be mentally, physically, or behaviorally, are some of the cues that let us know that something isn't right and it's time for us to get more help.
And you can always get your book, Dr. Burnett Zeigler. Thank you so much. The name of the book is Nobody Knows the Trouble I've Seen: The Emotional Lives of Black Women. It is available on Amazon or at ingerbz.com. Up next, a look at the